If you're out there and you've heard your medical doctor or your endocrinologist say it's not reversible type 2 diabetes, it is. The stats are there, and it's really like amazing on your website just looking at all the stories. And maybe you can just share the stats on Virta Health, because I think people, that are very number and data oriented want to know, what percentage of improvement you get across the board, because you've obviously scaled this. I'm just one doctor in my rooms, and maybe the other functional medicine doctors that we part of a group and we do functional medicine. Yes, we can help those patients, and we use health coaches and we use data, but it's not scalable. You've taken this to a scalable model, which is amazing because you can help millions and millions of people. But give us the stats, number one, and then maybe just share a common story of, you've shared your own story. Tim Noakes, who was on the podcast, said that after all his marathons, he was skinny fat and he had type 2 diabetes. So this is a common problem because people are picturing, oh, you have to be overweight and you don't have to exercise. You have to be not exercising to get type 2 diabetes. No, you can be skinny fat and you can be an athlete and still get type 2 diabetes. So share the stats, and then just share two common stories, maybe a male and a female, of a common sort of archetype who comes to Virta and then has reversal of type 2 diabetes.
Yeah, absolutely. And I might also, share a few business statistics, although patient outcomes, clinical outcomes are all, but I sometimes, people listen, they say, who is this guy? Maybe, he has 3 employees and some sort of a corner shop somewhere, to try to establish a little bit credibility. So
Yeah.
just as a company, we've more than 100,000 people have benefited our treatments. We've raised $360 million of equity financing for the company. We've generated more than 100 million in revenues. We work with more than 500 large payers, anything from large employers like United Airlines to large insurance companies like Blue Shield of California to government entities in the US, the Veterans Administration. We've been in the business for about 9 years, commercially available 5 years. We're about 600 employees as a company, and today we just focus on US, and roughly doubling each year in terms of the
Wow.
business of patients we treat. So we're growing pretty fast. And so I would say, and we're still a privately held company, but probably in a position to go public in a very foreseeable future, I would say. Again, the fact that we're a business, it's just a vehicle for change. And I truly mean that. The reason Verta exists is for our mission, which is reverse diabetes in 100 million people. And that's why I started the company. But obviously, business is the vehicle that allows us to scale and then make it self-sustaining. So I just wanted to throw out a couple of statistics to try to establish the credibility a little bit, that we didn't start yesterday and we've treated a couple of people.
Yeah.
But again, to the most important thing. So in terms of outcomes, a few statistics. So we actually ran a 5-year prospective clinical trial and have published about a dozen peer-reviewed papers now. And the reason we did that wasn't because we needed regulatory approval or FDA approval. No, we're not a new drug. We use nutrition and telemedicine, and we have providers, we employ providers, but you don't need regulatory approval when you use food or nutrition as a therapy. But the reason we did the study is to be able to have conversations like this, is to be able to have conversations with the government entities, is to be able to have conversations with very credible Fortune 500 companies and say, this is real. The numbers that we say, this is real stuff. So a few statistics. First of all, if we just start from weight loss, our average weight loss on an intent to treat basis, this is average, not the best, is 13% of body weight at 1 year,
Wow.
which is remarkable. But what's even more remarkable is the same 13% is sustained at 2 years, which is unheard of nutritionally. It's literally unheard of because most quote unquote diet exercise programs, you lose weight for 3 to 6 months and then it kind of creeps back by sort of month 9 or month 12. So that's weight loss. In terms of diabetes metrics, we use a measure of diabetes reversal. So nearly all of our patients improve, but 60% of our patients have achieved what we call diabetes reversal at 1 year, which
Wow.
compares to close to 0% in standard of care.
Sure.
And
Incredible.
when we say diabetes reversal, some people like to use terms of diabetes remission, but the bottom line is your blood sugar comes down to a normal level, and simultaneously we have eliminated all diabetes specific medications, which again is kind of thought to be impossible. Another metric, I like to talk about insulin because it's often thought as the kind of last hope drug. You have pre-diabetes, then diabetes, your blood sugar control or blood sugar is out of control, then you're on insulin. And it's thought to be like, okay, this is the end of the road. All we can do is increase your insulin dose. About 60% of all insulin doses are eliminated at 1 year. And from start to 2 years, 80% of insulin on an average is eliminated. And of course,
Incredible.
many people get completely out of it. Um, and then I'm not going to mention numbers, but I'll just give you an example. We talked about this metabolic disease, diabetes, obesity, and then a lot of these other things go around. But what we've been able to show, in addition to weight coming down, blood sugar coming down, getting off the diabetes medications, is the following. And this is all peer reviewed, so I'm not just making things up. Is hypertension, so blood pressure improves, cardiovascular disease risk markers improve, and lipids come down. Inflammation, as measured by CRP and white blood cell count, comes down. Non-alcoholic fatty liver disease markers improve. Kidney markers improve as measured by eGFR. So we've been able to take from 3B to 2, which is thought to be impossible. So reversing kidney disease markers, which is thought to be impossible nutritionally. Sleep apnea improves. Knee pain improves, perhaps unsurprising. Depressive symptoms improve. These are all peer-reviewed results. This is not one-time anecdotes. So I
Yeah.
just wanted to, so those are some of the results. So the sort of the net of it is that when you address the underlying drivers of type 2 diabetes and obesity nutritionally, very broad spectrum of metabolic markers and conditions improve, which goes to show that these are not, 8 different diseases. We're talking about one single thing, which is poor metabolic health. And then it has a number of these different symptoms. And unfortunately, in Western medicine, which I'm a huge believer in, we see them as different diseases. And so you go to a doctor, say, oh, high blood pressure, high lipids, high blood sugar, high weight. All right, I'm going to describe 6 different drugs to 6 different
Yeah.
diseases, which is not true.
Exactly.
So anyway, so those are population level results. Then in terms of individuals, well, first of all, we've treated men, women, all ethnicities, socioeconomic status. We've also published results looking at different age, different ethnicities. And in America, we call it Area Deprivation Index, ADI. So we can look at different socioeconomic status of people. And again, published data, peer reviewed. No difference, no substantial difference in outcomes. So we've been able to be successful in all these different groups. Um, but maybe, there's a gentleman in, let's see, I'm trying to think a good example of who to talk about. Maybe I'm not going to mention names, although some people have been in public, but the one gentleman comes to mind who, this is kind of an extreme outcome, but first he lost 80 pounds, then 100 pounds, then 200 pounds. And now he just ran his first 5K in his life. And this gentleman is not very old, so just the middle age. Um, Came in on, I don't know, somewhere between 7 and 10 different medications. This is also very common. And when people have type 2 diabetes only, it is usually 2 or so drugs for type 2 diabetes. Then they also have high blood pressure. So you have a drug for that. There may be some depression, kind of mental health issues that go hand in hand. So there may be something for that. Then there may be water retention. There may be it's ridiculous. So most of these folks, including in this case, the person came with a good nearly dozen different drugs, and now he's off of all these drugs that were treating symptoms. So that's a typical story, but obviously somebody losing 200 pounds, which is almost 100 kilos, 80, 90 kilos, is obviously extremely phenomenal outcome,
Mm.
but that's just kind of what we see.